This is the second part of a three-part series that I'll be putting out on the hips. And with that, a lot of these principles that I'm speaking about can also be applied to treating the low back. But primarily I'm going to focus on the hips and the pelvis because it is such an important thing to understand, not only for hip conditions, but also for lumbar conditions as well. I want to begin this section by talking about local points for hip pain because these are widely used in TCM practices. They are sometimes necessary. However, they're not necessarily the best place to start for several reasons. So sometimes when we do local needling, it can make the problem worse. And this can happen with a lot of acute conditions. Widely known is that we're not to do acupuncture on acute ankle sprains because that can aggravate the situation. Well, the same thing can happen with acute conditions of lumbar pain and hip pain. Local needling will not only aggravate many acute conditions, but other patterns as well, such as neuropathic conditions, meaning when the nervous system is involved. So sciatica or lumbar radiculopathy are all based in a neurological condition. Neuropathy can also be aggravated by local needling. And nerve impingements in general are a form of a neuropathic condition. And so when these are present, then it's best to avoid local needling and start with distal needling. And this is a system that I teach not only for the hips and lumbar conditions, but also for the neck and the shoulders and really any kind of condition. I even use it in the treatment of internal disorders as well. And this system is to start with the more distal points on the limbs and then move more proximally either in the course of a single session or over a series of sessions. So when I'm treating the hips, I'm not going to do local needling often until the third or fourth session at the soonest, and only if I absolutely need to. So most of the times I don't need to do local needling, but for those clients who are non-responders and have big body types and they don't respond that well to acupuncture in general, then those types of clients I do want to do local needling on, and I may even use electricity as well, because there is a subset of the population that does respond better to local needling and with strong stimulation like you get with electroacupuncture. However, most of your clients, I would estimate that 80 to 90% of them, you don't need to do local needling for. However, for the hips, it is one of those conditions where you will encounter patients that will respond best with that. However, for neuropathic conditions, then you don't want to start with local needling because you may aggravate it and make it worse. And sometimes we don't know what the condition is. Maybe the client doesn't have a formal diagnosis and we do the needles, and perhaps they're local needles or points on the gallbladder meridian, and the pain gets worse. When that happens, don't do points on that meridian or on that fascial line or in that region again, because chances are you'll aggravate it again. So this is why it's important to know about non-local needling and to start with that, because there's a lot less likelihood of aggravating conditions when you start with non-local points. So I do want to say a few things about local points for hip pain here and just mention some of the groups. So these points in purple, this is GB30 here, and then GB29 is located approximately in this region. You'll see these points in green, which are a group of the master dung points. And James Marr lists these as 88.09 in his numerical system, and he refers to these as the Fortify the Hip 3 needles. The first point is halfway between the apex of the iliac crest and the greater trochanter. So if you draw a line between the top of the iliac crest and between that and the trochanter, you've got a point there in the middle, and then halfway between the center point, and the top of the iliac crest is another point, and then halfway between that center point and the greater throat channel is a third point. So you can do that as a group of 3 points. And it's similar to using GB30 and GB29. However, they're on a vertical line rather than on that horizontal line. So if you're doing local palpation and you find that those points are more sensitive than GB30 or GB29, that can be a good point group to use instead. Or if you are doing local needling and you've needled GB29 and GB30 and you've gotten some result, perhaps the pain level has come down a couple points, but you've reached a plateau or a tolerance, then you can switch to doing this line here. And these little adjustments like this will help to ensure that you approach it from different angles and get to some of the tender points that you may not otherwise get to. Now, there's another group of points here, 88.08. This is also from James Marr in his Daoma book. And you can see these points in white here underneath the buttocks. Now, these are points that I very rarely needle because I don't need to, and they're invasive. You got to have the client undress, and why needle points like this or even like these if you don't need to because you've gotten really good at non-local points. Now, one of the other things about needling local points that I don't like is that you can't have the patient do movements. So I like to start by doing non-local points, and then I can have the client do movements for their hip while they have the needles in. So we've talked about the shoulder triplets. One combo that you can do then is the shoulder triplets on the opposite side of the hip. And then when you got those points in, you can take the client through a series of movement where they're going to be moving the hip joint. So that's a really good method to use, not only for the hips, but for the low back, for the neck, for the shoulders. It's something that Dr. Tan taught in the balance method, is that you do the non-local points and then you have the client move. So one benefit of understanding the functional anatomy of the hip and hip flexion, hip extension, abduction, adduction, and internal and external rotation is that you can then start to prescribe movements that the client needs. So in doing that, then you're going to be accounting for some of the structural imbalances that are present. However, if you're only doing local points or only doing Zong Fu methods or TCM practices and doing those local points, you're not going to be able to take the client through range of motion exercises, and you're not going to be able to have them move that affected area when you have local points in. Okay, so this is a really important reason for doing non-local points, is because you can use acupuncture with prescribed movement that will help to account for any of the structural imbalances that are present. Now, in my course, I outline 4 case studies, and we talk about external rotation and internal rotation and some of the different things that you can do when those types of structural imbalances are present. So if you're not accounting for those in treating hip pain, then you're missing a really important thing, because a lot of the clients who have problems in their hip and lumbar area have structural issues going on. Now, this doesn't mean that we need to become as proficient as physical therapists or osteopaths or chiropractors. It just means that by having a basic understanding of the hip and accounting for the 6 movements of the hip joint and incorporating that knowledge into the way that we do acupuncture, that will allow you to go to the next level and take out a lot of the guesswork and take out the shotgun style approach of just loading them up with a bunch of needles and then hoping they get better. When you understand the functional anatomy and the different movements of the hip, then you can pinpoint your needles in the area which is going to give the best response, because you'll understand the way in which people are holding chronic contraction in certain muscle groups, and then the way that that creates strain in other groups. So I can't emphasize this enough, the importance of understanding this relationship between chronic contraction and chronic strain. And a lot of times people feel pain not where there's chronic contraction in the hip, but where the strain is happening. And if you're only treating the pain based on system 6 or by needling the affected meridian, you're going to be missing some of those muscles and those muscle groups that are in chronic contraction. Now, this can get quite complex, but I like to keep things really easy. And the best way to understand these dynamics between chronic contraction in muscle groups and chronic strain in other muscle groups is to take this back to the myofascial lines, because they're so similar to the meridians. And then we just apply our yin-yang way of thinking. So, for instance, if someone has chronic contraction in their hip flexors, then that's going to put strain in the hip extensors because of this relationship between the flexors and extensors. If one muscle group is in flexion, then the other group, the extensors, will go into strain. Okay, so chronic hip flexion, then from sitting too much and getting tight hip flexors, is going to put excessive strain and excessive lengthening in the hip extensors, and that is often where people will feel the pain is in the area of strain rather than chronic contraction. Now, in understanding that, we need to ask, well, what points do we do to address that? And that's what we'll be discussing more. That's what I go into great detail in my course. And I want to give you some more examples here. So let's go ahead and talk about some more points, though, because it really helps us to understand the anatomy of these myofascial lines and what points are on what lines, and then understand how this relates to that functional anatomy and the chronic contraction and the chronic strain in different areas. So some of the additional points for hip pain that we discuss in this course: on the deep front line. So you'll see the deep front line in this image over here on the right. And remember that this deep front line includes the liver, spleen, and kidney meridians. And we can use a point like liver 3 for hip pain. You'll frequently see this as a point for hip pain in your textbooks. And really any of the liver points from liver 3 to 11 can potentially be used. There's a lot of points I don't use on the liver meridian because there's more effective ones. However, we could potentially use any points on the liver meridian, provided that it's getting to this deep front line. Now, not all the points on the liver meridian are going to reach that deep front line, and it depends on your needle depth and your needle angle. So you need to make sure that you're getting that right. And this is another advantage of learning about the myofascial lines. So when you understand the anatomy of this, you don't have to memorize needle depth and needle angle. It just makes sense based on the anatomy alone. Now, another group of points, you're not going to hear about these too much, and traditionally, they're not necessarily indicated for hip pain. However, they are indicated for low back pain. And this is this region from spleen 6 to spleen 9. Now, in a TCM approach, we wouldn't necessarily use these points for low back pain. However, in the master dung system, they'll use spleen 9 with another point, 1.5 sun distal to spleen 9. They'll use those 2 points for lumbar pain. Now, if you just do those points for low back pain or hip pain, there's a good chance that you're not going to get a result. However, you will find that for some cases, those are the best points. And we need to ask the question then, whenever we do a point group and it doesn't work, well, why did that point group not work, but this other point group did? So by understanding the anatomy of this and what myofascial lines these points are on, then it can help us to better understand why some point groups work for some clients but not for other clients, and how we can proceed with our treatments. I've also listed kidney 7, kidney 8 is the Shi cleft point for the Yin Chao, kidney 9 is the Shi cleft point for the Yin Wei. And these kidney points then are going to affect this deep front line as well. And we can use deep front line points for many types of pelvic conditions. So if you think about your traditional point indications like liver 3, spleen 6, the kidney points, we use them for gynecological conditions. We often find kidney, liver, and spleen points indicated for a wide variety of gynecological disorders. However, we also find them used for hip, pelvic, and lumbar and urinary conditions as well. So that has to do with this relationship then with this deep front line and the 3-leg yin meridians. And just continuing on here, it says the Yin Chao is indicated for hip and low back, and Dung's points groups on the feet, legs, and thigh. So the dung system is really profound when you look at the way that it's numbered, and I don't want to go into a lot of detail here about it, but it has its own method of categorizing and grouping points, and it does so based on different body regions. So the points in the feet are given the prefix 66, and then that'll be followed by 2 more numbers to indicate precisely what point, and then the points in the leg have the prefix 77 point, followed by 2 more numbers. So in the dung system then, they categorize points based on if they're on the feet or the legs or the thighs, and then the numbering system tells you exactly where the points are at. This took me a lot of time to figure out, but it's really quite brilliant the way that this is done, because different points in different regions will produce a different effect. So for instance, the points on the hands and the feet are more sensitive, and they are some of the better points for treating conditions of the head and the neck and the face, likely because of the sensitivity and the density of the sensory nerves and the nerves in general that are in the hands and feet. So because there is this high concentration of nerve endings in the hands and the feet, then that likely has something to do with these points having a strong effect on the head and the face. Now, we can go into more detail about this, and the points on the legs and the points on the thigh, they have functions for entreating the internal organs, and as we move more proximal up the legs and up the arms, then we start to find a lot of these more proximal points being more indicated for internal conditions. And this has to do with the structure of the nervous system and the way that it's laid out, and I'm not going to go into detail about that now, but that's just something to keep in mind. The next point here reads, the stomach meridian, 4 horses for lung deficiency back pain. So if you know about these points here on the stomach meridian called the 4 horses, they're widely known for treating respiratory conditions and skin conditions, but they're also indicated for back pain, or what they'll say is lung deficiency back pain. So these points, though, they can be very good for treating anterior hip pain because of this relationship with the quadriceps, and specifically rectus femoris, and the way that it is involved in hip flexion. So in understanding these myofascial lines and the individual muscles and their functional activity, then it really gives us insight into when we can use the 4 horses for treating back pain or hip pain. Now, if you just do the 4 horses as a group on their own for treating back pain, you're probably not going to get very good results. However, for some cases, you'll get great results. But there has to be a specific pattern going on within the hip and within the pelvis that relates to that. So if you understand the different ways in which the pelvis moves, such as anterior pelvic tilt or posterior pelvic tilt or lateral pelvic tilts, then you can better understand when points like the 4 horses can be used for treating hip pain. So in some cases, those 4 horses and points in the anterior region are going to be some of the best points that you can use for treating not only the hips, but also the low back. But you've got to understand that functional anatomy of the hip and when to use those points. Okay, the last line here reads urinary bladder meridian, UB40, UB57. So I've just listed some of the common TCM points that you may find for hip pain. So UB40 is here in the back of the knee, UB57 is halfway down in the calves. So I don't typically use these much for hip pain. Occasionally, however, I tend to use those more towards the end of a series of treatments. By the third or the fourth treatment, I might, or if a person's a non-responder. You don't need to use these points very frequently, even if it is posterior or posterior and lateral hip pain. You can get results with these points, but it's not necessary to use them, and there's really more efficient ways to do needling. So with these points too, they may not be right in the hip or the back themselves, but they're on this line. So we can see how if we needle points on this line, either in the hamstrings or in the calves, we can potentially affect this lumbar area. However, a main reason I don't like to use them is because, first of all, I don't need to, because I get good results with doing distal points. But if you put these points in right from the start, then you're not going to be able to have your client go through movements to work the hip and to move the hip through its range of motion. So I don't like to needle them for that reason, because I'm not able to teach the clients movements that they can do on their own.